Good morning, everybody. It's first days of checkoffs. I am scared, nervous. I don't know why, but anyway. So come with me. I want to record it with also maintaining the integrity of the school and other people around me. So here we go. Hey, y'all. So I did say that I wanted to give like a in real time review of day one so you all can kind of know what we did today. So we went off checkoffs, did wound care, we did we checked, Lord, there's so many checkoffs I did today. Hand hygiene, we did a Foley catheter, we also did trach cleaning, sterile fields, sterile gloves. We did some simulations, and I got to school probably about 7:45 a.m. I didn't leave till after 7 p.m. I am tired. I am exhausted. The word intensive means it's intensive, but it's very much intensive. I think my brain hurts, and then we do head to toe assessments tomorrow. I'm exhausted. I don't know if there's any room in here for it. I'm happy to say that I did pass my checkoffs, everything first try. Don't have to come back for a second attempt because they allow you to have 2 attempts. But I wanted to just come in and give y'all like a real quick. I'm exhausted, and to be honest with you, the only thing I want to do is sleep. I do not want to look at any books. I don't want to look on my computer. I don't want to go over my checkoffs. I don't want to do anything. I'm tired, but I'm gonna go and I need to rest for a little bit. And then I figured the best thing I should do is get a good night's sleep and then wake up early in the morning and then start going over some stuff in the morning. But day 2 is tomorrow. I'm tired. I'm exhausted, and it was pretty good day. Got to meet a lot of nice students and people from all walks of life, all across the country, and every age group is represented. So you have some young students, and then you also have some middle-aged students, and you have some older students. And all of the teaching staff was great. So yeah, day 2's loading. Intensives is not over. Day 2 is complete, and I want to give y'all a very organic and true response to what I feel. I am sitting in front of Olive Garden waiting for my to-go order. I'm exhausted mentally and physically. I didn't anticipate intensive to take so much out of me. I have lived in a space where I'm always on 10, always worrying, always scared, not sure what's going to happen. But this was on a whole nother level. Today we had to do head to toe assessments. I failed the first time. I did. You have to use the proper terminology, and you have to indicate what exactly are you assessing. I'm going to come back and do a video of my full head to toe assessment with my kids when I get back home, so that I can really nail it down. I did pass. And also we had to do blood pressure, pain, take pain what their pain levels are. We also had to start an IV. We also had to do give insulin, and we were able to use some of the rubber dummies, like the rubber skin. We had like the IV. We had like the fake arm. We were in the lab. Today was very stressful. The instructors were really great. They were very supportive, but it's intensive. And if you're going to do this master's degree direct entry, prepare yourself ahead of time that medical terminology and the right body parts is important. You need to know the anatomy of the body. So I'm stressed out, like so stressed out, and I'm glad that intensive is over. I'm glad that I was successful in it. But I also wanted to state that in some way, shape, or form, there was a mishap in my schedule, and I was not placed in one of the classes that I should have been in. I should be in a clinical
class, which I didn't get. So I ended up at intensive, but don't have the class that goes along with it. I'm not sure what we're going to do right now about it. I'm not sure how they're going to work it out and fix it, but it wasn't my era. And I'm glad that I came and I was successful in this, and this part is checked off. I have all of my paperwork. I'm going to photocopy everything. I'm going to keep a copy for myself, and I'm going to upload it into my stuff. When I get back home, I'm just going to continue to work on these skills so that I can be a master at them. So when I do go to my clinical site, I'm more prepared. I'm better prepared, rather. Well, all in all, the Hersden location was great. The team was great. The facility was clean, nice. They had everything there for us to use. And I would give the experience, it was a 10 out of 10, right? But for me personally, and how I felt in the process and the stress that my body endured, it was a lot. And I'm coming from a place where I am the mom, and I've seen the medical side of it, being a parent of a child. Now me being on the other side of a nursing student who will go to apply this stuff, I'm now understanding why things are done the way they're done. I've seen my son get IVs hundreds of times over the years, but for me to actually start it, I've never done that before, so I'm trying to wipe away some of the stuff that I've heard and I know about from my time, being in the hospital with him, to just now saying, okay, this is the nurse part of it. But anyways, that's the end of day 2. Peace until next time.